4 million people are alive. There you go. Yeah.
Okay. LANI, Local Area Needs Initiative, was started in 2014, became official in 2017. The function is to help people who are trying to help themselves. We work hard to do that. We get no government funding. We function because of generous people like you all who have helped us with money. We pay bills, we don't give cash. People call my number, which is all over the country. I've had calls from far away as Chicago saying, help me. Somebody said to call you, and so here I am. And so what can I do? So I had ideas, although everybody didn't live in Camden County. We work primarily with the Lake area, Camden, Miller, and Morgan counties. We have, last year we spent $36,000. Of that, $1,600 was for admin. And that's raised more than normal because we had some trouble with some taxes. And I'm sure you understand that. And so I finally gave up and went to an accountant, and they did it. And that raised it up. But we spend money where it's needed, when it's needed. They call me, I get the phone call, and they need, and I say, okay, I can't do all of that. Tell me, let's talk about what your needs are. How much money, what have you got? Your electric bill, I understand it's high. They're high right now. But do you have something to put in? No. Well, what happened? Because this is a bill you know is coming in. So I used to be embarrassed to talk to people like that back a long time ago. And then, however, I worked at what was then First National. And one of my first jobs was to call people on the overdraft list. And people I knew, because I've lived here almost all my life, except when I was gone. My husband was in the Navy and that kind of stuff. And I thought, how could I do this? And I thought, it's not my fault that they're in the overdraft. They did it. So I can just call and be matter of fact about the process. And that has really one of the things. So I talk to people about what happened. Where does your money go? Where do you spend your money? I used to talk really hard about giving up smoking. I don't anymore because it's a given. I can't do it. They can't do it. I do explain to them how much they're spending on it and where their money goes. What are you doing? LANI will help with any, if we have the funding, we will help with any bill that is not illegal or smoking or alcohol. So we do that, but we try to help them figure out what's going on in their lives. We do have a monthly class that MOCA, Missouri Ozarks Community Action, helps us with. The last Monday of every month, it was 2 days ago, where people come. They don't get paid to be there, but they learn about money management. And money management can cover a whole multitude of things. What are needs versus what are your wants? Where does your money go? How much are you spending on various kinds of things? And they say, I don't have any income, so I don't need to go. No, you got to go. If you want me to help you, you got to go. So when people complain and they say, well, I can manage my money, then why are you calling me? So, and I can do that. I talk to that. So that's the purpose of our, as you can see from this list, transportation is a huge list. On the right-hand side of the paper, it talks about the breakdown of transportation, repair, payments, other could be court costs or trying to get their driver's license, fuel. If they want to go to work, but as you know, the price of gas seems to fluctuate quite a lot. It went up overnight, 20-some cents. So it's hard to budget how much fuel you need. Also, we have employees in the area who will say, okay, you work here, but I want you to go to St. Roberts tomorrow to work, but no extra pay and no transportation. So they got to have money to get there. They budgeted getting from home to work, but not from home to, say, St. Roberts or Kansas City or wherever. And they don't get paid the fuel. They don't get paid a fuel cost. So that's where it is. Or we've got to get to the doctor, and I can't because I don't have enough money. That wasn't planned in. I have, at one point, this is not this year, but several years ago, a lady called and her husband was in the hospital dying, and she didn't have gas to get there. So we help with that. We help with almost anything whenever people need it. My phone is, it's all over, 573-480-1221. Didn't intend for it to be all over because it's my own private number, but it is. And so I now start, people call and I'll say, text me. And if they keep calling, I'll say, why aren't you texting? I can't text, I can't read, I don't know what to do. We have an awful lot of people who cannot read. That point, and my phone has got multitudes of contacts in it because I won't want to miss them if I know who they are and why they're calling. But that's the kind of things that we work with. People that have almost nothing and yet are working hard. It seems like sometimes there's people out there that have a little black cloud. Those of you that are old enough will remember the cartoon about the little man who had a little black cloud. Remember, he went, it rained on top of him. It was an Al Cap cartoon. And it's like that. It seems like anything they do, there's an unintended negative consequence. So I try to work with people. I talk to them a lot about why is this happening, what's going on. For instance, it started, and some of you with the said December, I'm sure I told you this. Bob Robinson, who was unable to be here today, came from St. Louis area, and he was a highway, or not a highway patrolman, he was a policeman. And he kept running into people who had situations where the lady he talked about was one whose taillight was out or a headlight, one or the other. And she got stopped on her way to work, and they said, okay, you got to get it fixed. And here's a summons. So you're going to have to get it fixed. You can come get it fixed and come to court and tell us. She didn't need money. She needed to get to work, but she didn't need money. And because she had 3 kids at home, she was a single mother. And so she did that. So she didn't work, or she didn't do it. And didn't get it repaired, didn't show up at court. They sent out a warrant out for her arrest. She was arrested. She was put in jail. She lost her job. Her kids went into foster care, all because of a broken tail light or a headlight. So we want to try to stop that process. What's going on in your lives, in their lives, that we can help with? So I need tires. Tell me about your tires. Where are they? What do you do? What's going on? How much? The cost. An awful lot of you'll see on here tires. We spent over $4,000 on tires. We try to work with employers or businesses who will give us a break, or at least give me a break when I'm trying to pay for it and talk, so that's the people can be helped. Do you have used tires? What can you do? What do you need? You get 1 tire. Well, you really should have only 2 new tires, not just 1, but sometimes you can only afford 1. So let's get 1 tire. The wires are showing. Well, we can't have that for all of us. We don't want somebody on the road who's going to have a blowout in front of us as they're going down the road. So we try to do things like that. Or they will have court costs because they didn't get the things done and they're going to go to jail. Well, let's see if we can keep you out of the jail system, because we don't want to do that. Healthcare. They're sick. They got to go to the doctor. They can't afford to go to the doctor. They don't have the insurance, or they can't pay for their medicine. I've written checks as low as $1 for somebody who couldn't pay for medicine. So that's what we do. That's where we go. The thrift store, the free store in Camdenton, we started several years ago. People just needed a boost. Our job is to give people a helping hand, pull them out of the hole. And so that's where we are. The free store, then we are we don't operate it anymore. We didn't, our business, our function is not to continue running stores, but to look for unmet needs in the community, see what we can do to fix it. One of the unmet needs was in the community, and we did not start this, but it's called New Growth Transportation. And any of you that are retired or have any extra time, they pay mileage, government rate, got mileage to drive people to and from work or to and from doctor's appointments. And there's a number to call. It's a 417 number. In fact, Larry Gertis, who is part of it, is part of that group, and him is driving somebody today or has driven them today to a lady to work and her child to daycare. And because the person who was supposed to be doing it called and said, I can't do it today. So Larry got the call and said, could you do it? So he did it. But that's the whole idea. The process is we try to figure out how to help people get out of the hole. One of the expressions that I hear, I'm poor ways. That's just how it is. No, it doesn't have to be that way. Stop it. Don't get that's negative thinking. Let's figure out what we can do, what you, with my assistance and the LANI's assistance or other organizations, can help get you out of the hole so you're always out of the hole. You don't have to spend all your time figuring out how to pay the utility bill, to get car transportation, or if your car breaks down, you'll have it figured out ahead of time. All of us need assistance from time to time. We know that, and I try to explain to them that's what happens. All of us need help in some way or other. But that's the purpose of the organization. On the classes that I talked about, we have personal hygiene items are not covered by food stamps. And so we try to have personal hygiene items available for them to pick up once a month, not to take 10 rolls or 20 rolls of toilet paper, but to take enough to get them by. So or shampoo, or so they wash their clothes, that kind of stuff. So they can take it with them free of charge, just take it, use it. That's the point. So are there any questions at all?
Yeah, I would make a comment.
Yes.
Been working at the funeral. We had a service last week over on J Road, and there was coming back. The fellow that worked with me, we were driving along, and this was the area that I'm not so well to do, and the guy said, "What there's," and he said, "New air." Fit in the area fairly good. He said a lot of people are curious. And I said, yeah, we think that there's, we're pretty well to do, or we move quite well, but there's a lot of people there. And the same thing without other than that, the land now and cars that drive up. There is a big need.
It's huge. It is huge. And rent, before COVID, you could rent a pretty nice place for $600, maybe even $500. Now, after COVID, I don't know what exactly happened, although I know some people moved into, because schools were going on here. They weren't other places, but rent almost tripled. What was $600 is now $1,250. And rent, our minimum paid jobs don't pay that much. They can't do it. It's just what's your budget? Where do you spend your money on? Okay. I want to know itemized where you spent your money. How much of it was for soda? How much of it was cigarettes? How much of it was for whatever, entertainment? I want to know exactly where your money went. And then let's see where we can figure out where to cut. And sometimes there's just absolutely no way. They already don't smoke. They already don't buy sodas. They already don't have an entertainment. They don't eat out. But there's not enough money at the end of the month or the end of the pay period to get them where they want to go. Yeah, it's a really sad. And I'm going to be evicted. Okay, how much? Where are you? Have you talked to your landlord? What's going to happen? Where are you? How far are you behind? But especially the Osage Beach area, this area is not quite so bad, but Osage Beach area, it'd be like $1,200, $1,300, $1,400 a month rent. I couldn't pay that, ever. So it's tough for those people. It's really tough, and we need help in doing that. And I certainly appreciate what you all are doing. This has been will be a real boost to us. And I thank you so much.
So do you have classes, or do you just pop those up once in a while?
I know the classes are once a month.
Yeah.
Once a month, and we can have a community Christian church, which is where I'm a member, so they let me have them for free. And they also collect, so any kind of personal hygiene items that we collect from anybody that wants to donate some. So if you're at the store, you see a fantastic sale, buy an extra, whatever. So we can give it away. And so that's they're every month. And if I help you this month, you better be there class. And just one time doesn't count. I want you to be there the last of February, the last of March, the last of April, the last of May, unless you're working. And if you're working, better let me know. Not when I can help you, but when it comes time for the class. I don't always, but I try to notify people when the class is coming, and then I will, so they can call me then, or they're sick, or if they have really young children. We are not set up for daycare, for childcare at there. And so they can be very disruptive. If they're teenagers and they're not in school, then they better be there, because they can learn too how to budget, what's the best thing to do. Budgets are actually, they how to manage their own money. So, but yes, they're once a month, and I have not helped people because they didn't show up for class. That's the last time. Where were you? Well, this happened. Did you let me know? No, you know, blah, 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 blah. Okay, you gotta be here, period. That's the rule. Yes.
So we had a presentation from Salvation Army Medicine, bell ringing this year, and they made the comment that last year the bell ringing only lasted 2 people.
That's right.
Are you seeing that this year so far? Or?
Yeah, so the Salvation Army bell ringing, we were $20,000, $10,000 less this year than we were last, and last year was terrible. People, I think, are scared. People that normally give to LANI, to Salvation Army, probably to other organizations, don't know what's going to happen, and they're scared to death. I mean, price tags is horrendous. I could, you know, eggs you could get from the farmer would be $3 a dozen. You could get them from the grocery store at $1. Not anymore. And so I think they're scared to give money. People, we're from in Salvation Army, it's Cabin, Miller, and Morgan, it's 3R. But in Miller County, the lady said, I usually get big checks. I usually get like several times a $100 bill. No, not this time. The biggest was 20. Don't get anything. Just, and they're dark, you know, it's just because people are scared and they have to take care of themselves first, and they're terrified. So it's tough. It is tough. And so we've been practically out of money for like 2 months. LANI has been. And so I have tried to figure out ways where you can go. I just have helped sometimes. It's just, I will do it because I know you got to get there. I have relationships with these people now. The families that we've helped are 294 this year. I have a good number of relationships. And also when they text me, I have a running list of what they've done and what I've said. So it's not a cold call each time. I know where we are, what's going on, what's happening, what the process is. When they call, how many people are in your family? Because I have to know, this is records. There's another, why aren't you working? There's another adult. Well, you know, I work, but he doesn't. Well, why not? Well, he needs to get a job. Have you talked to him about this? Well, he's trying to work it out. Well, he's got to get it. That's his responsibility, or he shouldn't live there anymore because he's got to take part in these expenses. I mean, I can be pretty tough. I'm old, so I can be pretty straightforward with that. So, any other questions? Thank you so much.
maybe we can help with your budget shortfall a little bit, so.
Well,
Those of you that are guests, we had pulled